Hello class, Dr. Nemecek here. Welcome to week 2 of our course. This week we're going to be talking about chapter 4, stewardship, and chapter 5, professional codes of ethics and ethical principles. But before we get into this week's lecture, I would like to take the time to acknowledge and thank you for your earnest participation in week 1. You're off to a really good start. I really appreciate the engagement that I'm seeing in the discussion board. And as you know, that's where a lot of effective learning takes place. So sharing your stories with each other and your experiences really is very beneficial to this type of course when you're talking about ethics. It's very helpful. So thank you for your participation this week, and we're off to a really good start. So thank you for really getting engaged. Okay, well anyway, in our second week of the course, we're going to be talking about actually getting into the definitions of chapter of what ethics and ethical decision making is all about. As I said when I opened, chapter 4, stewardship, is what needs to be talked about, where your objectives for this chapter should be to be able to define stewardship and its role in healthcare managers' duties, be able to explain the fiduciary duty of healthcare managers. That word fiduciary, if you're not familiar with it, has to do with financial management or responsibility. Financial responsibility. Explain environment. You should be able to explain environmental sustainability as a moral imperative. You should be able to discuss the responsibility of organizational stewards to stakeholders, and you should be able to discuss healthcare managers as ethical leaders. So the first thing that we jump into is the definition of stewardship. Stewardship is the act of putting first the best interest of stakeholders that leads to building and maintaining trust. And having said that, that definition, this is what you should understand from that. Stewardship requires us first as individuals to treasure the trust we have received from the community as the necessary context for pursuing a prudent use of limited resources. Stewardship invites us to recall who we are via our organization mission as the context that will inspire us to meet in an ethical manner the needs of financing, delivery, and care in the field of today. So that's a mouthful, but essentially what we're saying is that stewardship is important to your responsibility as a healthcare manager or leader. You are taken care of by virtue of understanding that you've got fiduciary responsibility. You are watching out for people's finances. You're making sure that ethically, or you're delivering and acting in a sensible and ethical manner when we're delivering healthcare. And in the field of healthcare in general, that field of study, we've got to make sure that as a potential or future healthcare manager of the future, you understand how important it is to maintain yourself in an ethical environment. Now, the role of stewardship and managers' duties can be identified as something that we identify and prioritize for stakeholders. We give support and sustain the organization mission by being a steward, and we maintain organizational integrity through reciprocity. In other words, what people give us in return, we give back to them, and vice versa. That's what reciprocity is. Let's talk a little bit more about fiduciary duty. Fiduciary responsibility, looking out for money. Fiduciary duty is the duty of an individual or group to act in the best interest of another individual or group. Duty of care is the responsibility that requires an individual or group to act with the care and prudence any reasonable entity would use. Duty of loyalty prohibits gaining advantages at an organization's expense, and duty of obedience requires adherence to the organization's mission. So under the category of fiduciary duty, you have the responsibility to make sure that you are overseeing duty of care. That's not only from your perspective or the people that work for you. Duty of loyalty, the organization, not only from your perspective, but for the people that work for you. And duty of obedience, requiring yourself and others to make sure that you support the organization's mission. So that's what the fiduciary responsibility is all about. Now, to show you how important this is and how serious it's taken by other people within healthcare, I know that you all are familiar with the Joint Commission on Accreditation of Healthcare Organizations. The Joint Commission has this as a very important part of the accreditation process, where they come in, they examine your organization, and they are looking for things that tell them that you embrace this concept of having fiduciary duty very first and foremost, and that you take it seriously. So they want you to understand that they describe fiduciary duty as being important from their standpoint of view, the Joint Commissions, that is, that they want to see this done in all independent, not-for-profit organizations that provide accreditation or certification to healthcare organizations and programs in the United States, and of which they are one. That one acts, to clarify that, they have a statement, the Joint Commission has a statement that applies to fiduciary duty that says this: that one acts to the best of one's ability in the interest of another, not in self-interest, is what this is all about. The other can trust the fiduciary, and that ethical obligation is taken over by those who choose to work in healthcare, not just those trained as clinicians, the doctors, the nurses, but also managers, executives, and trustees. So the Joint Commission has really made this one of the important points that they want you to embrace and also understand that concept. They also talk about corporate social responsibility from a stewardship standpoint of view and moral imperative standpoint of view. And what they say is that both corporate social responsibility and stewardship take into consideration the effects that the organization's policies have on stakeholders, which in the process garners goodwill and trust. And then they talk about moral imperative. A policy becomes a moral imperative if it is something that should happen because it's the right thing to do. Environmental sustainability policies like mandatory flu vaccination policy has become a moral imperative for many healthcare organizations. And they use that as an example because flu vaccine is considered to be the ethical thing to do, not only to protect yourself and your family members, but to protect your patients as well. So from an ethics standpoint of view, that's how they look at it. The Joint Commission also considers what we were just talking about relative to fiduciary responsibility. The disclosure of medical errors is something that's very important as well. The Joint Commission requires accredited healthcare organizations, such as you hope to be and always be, to have a process for disclosing unanticipated outcomes of care. In other words, disclose medical errors when they occur. And that should apply to all the stakeholders in an organization that includes your doctors, your providers, your patients, the public, and your board of directors. Everybody should have an understanding that from a fiduciary standpoint of view, the organization is going to disclose medical errors because it's ethically the right thing to do. They further go on to say that disclosing medical errors lends transparency to the organization, and they give an example of what is referred to as the Lexington model. When they talk about transparency, they're talking about a policy of sharing information and communicating directly, honestly, and in a timely manner with everybody that's involved. And our authors bring to our attention the Lexington model, which is where risk management, this is a risk management program for disclosing errors that was instituted in the Lexington Veterans Affairs Medical Center following a patient's death. And there's an example there to tell you all about that story in this chapter that you can read about and take that, try to digest that information and see how it pertains. So again, we're talking about stewardship and the importance that that plays relative to ethics and fiduciary responsibility and duty as a healthcare manager. And having gone over that stuff, try to remember these points. In healthcare delivery, stewardship of healthcare managers means acting in the best interests of patients, providers, and staff, and the community, which results in building and maintaining a trust relationship. Healthcare managers fulfill fiduciary duty responsibilities by acting in good faith with the care of an ordinarily prudent person who would exercise under similar circumstances. The three responsibilities of fiduciary duty are duty of care, duty of loyalty, duty of obedience. Environmental sustainability is a moral imperative because it is the right thing to do for various reasons. And lastly, the moral context of a stakeholder theory refers to the responsibility that stewards, be they board members, leaders, and managers, have to those who have a stake or an interest in the organization, a moral imperative to make sure that we're doing things from a stewardship standpoint of view and making sure we're being responsible in treating everybody ethically. So that's chapter 4. Now, to put a finer point on all of this, we go into the professional codes of ethics and ethical principles, which you'll find in chapter 5 of your textbook. And the objectives for chapter 5 is you should be able to understand the codes of ethics of healthcare management professional associations, of which there are several that are talked about in chapter 5. You should be able to explain the relationship between codes of ethics and professional norms, and you should be able to describe how codes of ethics can be applied by healthcare managers at all career levels. So let's take a look at what professional codes of ethics, what they're talking about when you put something like this on paper. Ethical principles that form a foundation have to deal with these things. Honesty in both personal and professional interactions. Integrity and character, decision-making and actions. Respect for self and others. That includes various customs, beliefs, practices. Justice in thought and action, such as treating employees and patients fairly, allocating resources equitably, and supporting healthcare access for all people. These are all professional codes of ethics that we need to subscribe to. Loyalty to the profession, this chosen profession that we have, that of healthcare, and the organization, the hospital that you work for, or clinic, or doctor's office, or whoever in which one works. This includes promptly reporting, addressing, and preventing potential threats and negative events. That's where that loyalty comes into play. If we're loyal to an organization, the expectation is that you will promptly report anything that is a potential problem from an ethical standpoint of view. You should also practice beneficence towards others, and mindfulness that every decision has consequences for people. Autonomy in decision-making, such as to protect the rights and interests of patients and other stakeholders. And lastly, honor and serving as a moral advocate. This applies to everything across the board in healthcare, and in this chapter they also give you some really good examples of how that can apply. They've got some case studies in this chapter that are excellent. And while I'm thinking about that, I want to remind you that these chapters have a lot of really good things in them that you should be taking for action and using for your benefit. In addition to all the stuff that we're talking about here, and that you have in a full slide set that's embedded in each week. They give you a lot of case studies in each of these chapters that you can look at, and then they talk in great detail about how all of these different sections, like for example, the topic of fiduciary duty on page 55 of your text, they go into talking about how that applies and gives you examples by using specific companies and things that have actually happened in the healthcare arena, that you can take that understanding and definition of fiduciary duty and apply it by reading these cases and understanding what it is that they're talking about. Some of the other things that I like about it also is that at the end of each chapter they have a mini case study that uses again examples of what it is that you're discussing in the chapter. They ask you questions that if you're able to answer those just by reading them after reading the case study, that should tell you that you have put in enough time reading that and understanding the definitions and your learning objectives for the particular chapter. And then of course they make points to remember also, which is what we're essentially doing at the end of these slide presentations. And then they've got a section that calls Challenge Yourself. They throw some more questions out there and get you to be thinking about different things that are pertinent to this particular topic. And then they have, for your consideration, some little stories also that they would like you to take into consideration and see how that information applies. So don't forget, this is one of the best ethics books that I've ever seen in a long time that really is very helpful in that regard. So before we conclude this chapter, they also talk about the ACHE, the American College of Healthcare Executives, and the way that they describe their professional codes of ethics. And in this your week's assignments, you're going to be asked for the discussion board to go to the ACHE Code of Ethics and read it. And you're going to see there their vision, their mission, their values, and it's going to tell you exactly what you see here in this slide. They describe their mission as being to advance our members in healthcare management excellence, their values of integrity, lifelong learning, leadership, and diversity. They talk about that and why it's important. Another organization is the American College of Healthcare Administrators. Again, they give an example in the textbook of what their vision, mission, and values are, which are similar to the ACHE's, but a little bit different. And in addition to having those codes of ethics, the ACHA-CA also has expectations. To give an example, they list expectation 1 as hold paramount the welfare of persons for whom care is provided. Expectation 2, maintain high standards of professional competence and personal conduct. Expectation 3, maintain a professional posture that places paramount the interests of the facility and its residents. And expectation 4, honor responsibility to the public, profession, and relationships with colleagues and members of related professions. So again, they're going to give examples of some of the professional organizations that you need to be aware of. And these are just some of the things that they have reduced to writing that should lend credibility to your understanding of the professional codes of ethics and ethics principles and why they're important to us as healthcare administrators. So in this chapter, chapter 5, the points to remember is that there are professional associations in healthcare, the American College of Healthcare Executives, the Medical Group Management Association, the American College of Healthcare Administrators, to name a few. They issue their own professional code of ethics and talk about their ethical principles that underlie these codes, and all of them are very similar in nature, but you can compare them and see what the differences are. Codes of ethics, remember this point also in this chapter, codes of ethics spell out standards of behavior that professionals will learn, follow, and internalize. Once internalized, those codes become professional norms for them personally. And be aware that a unified transdisciplinary code of ethics for all healthcare professionals has been proposed, although none exists thus far that we're aware of. But there's been a push on for quite a few years that despite what area of healthcare you work in, whether you're a doctor or a nurse or a healthcare administrator or whoever, that one code of ethics is going to apply to everybody, because it seems like we've got a million of these from different organizations. And last but not least, codes of ethics can be applied throughout a healthcare manager's career and influence behavior. So that, in a nutshell, is Chapter 5. So make sure that you spend some time reading in detail all the other information, supporting information that just brought to your attention exists in these chapters, and I think you'll find that that is very beneficial. So again, thanks again for your kickoff last week and how well you're doing in the course and having some really good discussions with the discussion board. Don't forget that to be able to reach me, you can send me an email or call me directly. I'm standing by ready to assist you with any further content where I can explain something that maybe you don't understand. Review the PowerPoint chapters, PowerPoints that are embedded in the course, because they're a little bit more extensive than what I gave you to now in this lecture. Don't forget you've got assignment 2 this week, participate in the discussion board, and you do have another quiz. So I hope you enjoy the information that you study about this week, and if I don't hear from anybody this week, I'll see you here next week with another video introducing our chapters in week 3, which will be chapters 6, 7, and 8. So have a good week, and I'll talk to you then. Bye.